Morning or evening, grace, brethren, and sisters. Guys, have all back along with us here with a Temperance Awakening, and I look forward to continuing in our tobacco lectures here this day. I'm going to be looking at cardiovascular disease and smoking. Going to be looking at cardiovascular disease and how that particularly relates to tobacco smoking. And now we'll go ahead and get started here. Some cardiovascular diseases, like heart attacks and strokes, can be fatal or leave patients seriously disabled. Tobacco smoke contains a number of chemicals that have been shown to damage the heart and blood vessels, setting the stage for serious and sometimes even fatal illnesses. While pumping blood throughout the body, the cardiovascular system performs several functions. Blood vessels deliver oxygen and nutrients to every cell in the body while removing carbon dioxide and waste. The heart stays on the job about 24 hours a day, 7 days a week, moving the blood supply about 10.5 pints through the entire body once a minute. The blood vessels make up a complicated network that reaches every cell in the body. Laid into end, these sections of body plumbing would reach almost 100,000 miles for typical adults, so that's how much work that they do. Most of that distance comes from the microscopic capillaries, tiny blood vessels whose walls are only 1 cell thick. Blood leaves the heart through the arteries, the largest of which, the aorta, is about the size of a garden hose. The arteries branch off into similar vessels, the arterioles, and then into the capillaries. These thin-walled blood vessels allow oxygen and nutrients to transfer out to the cells of the body. Waste products and carbon dioxide filter back in. The capillaries grow together into venules and then into veins which head back to the heart. Blood also flows to the lungs to eliminate carbon dioxide and get a new supply of oxygen to the digestive system for nutrients, and to the liver and kidneys where waste are removed. The cardiovascular system is complicated and performs a critical function. If the flow of blood becomes blocked because of disease, the results can be very serious. Several components of tobacco smoke damage blood vessels, creating the potential for cardiovascular disease, while also putting additional strain on the heart. And now, we're going to look at some particular cardiovascular diseases here. According to figures from the CDC, Centers for Disease Control and Prevention, cardiovascular diseases are responsible for almost 40% of deaths every year in the United States. Approximately 950,000 Americans die of cardiovascular disease every year. 1 death every 33 seconds. It's quite the bit. It's the largest in the United States. CDC figures also show that more than 99,000 of those deaths are linked to smoking, which is common with my wife's immediate family. Excuse me. Her father was a big smoker. He died at 51 because of heart problems related to smoking. Her brother died even younger at 43 because of smoking. Every time a smoker lights up a new cigarette, that fresh dose of nicotine puts additional stress on the cardiovascular system. Nicotine pushes the heart to work faster, 10 to 20 more beats per minute. Nicotine also causes the blood vessels to constrict, pushing up blood pressure 5 to 10 points, and these are only the short-term effects of cigarette smoke. The long-term effects of smoking, as I just said, are often much more serious, and they create much more problems for the cardiovascular system. Now, particularly looking at something called atherosclerosis. Smoking has been connected with this disease, atherosclerosis, a condition also known simply as hardening of the arteries. That's what most people know that as. It's pretty common, the hardening of the arteries. And arteries are very complex structures constructed to be both strong and flexible, because they do a very important function in the body. They must withstand the rush of freshly pumped blood. In comparison, blood pressure in the veins is only 1/10 of what the arteries must handle. Arteries must also be able to expand or close down. And to meet these needs, artery walls are composed of alternating layers of expandable tissue and muscle cells. Sometimes the innermost layer of the artery becomes damaged. The artery wall thickens as fatty deposits gather. As these plaques or thickened sections grow, the arteries become less elastic. The growth of plaques narrows the inside of the artery. Plaques can also break, creating blood clots which completely block an artery, which give a lot of people issues. And now medical researchers are still trying to understand exactly what causes atherosclerosis. And so they're still doing research to try to figure out exactly what causes this. But a major contributor certainly is smoking. When the arteries of smokers are compared to those of non-smokers, smokers have less flexibility in the blood vessels and larger plaque deposits. So smoking seems to accelerate the process of hardening of the arteries, and also other factors of this can mainly be to people who are overweight and don't exercise, like obesity, high cholesterol, and a lack of exercise can also lead to people having this hardening of the arteries, as that is also, a common, you might be aware, very common problem, for obese people. Smokers have problems with their blood as well. The carbon monoxide in cigarette smoke binds with red blood cells, cutting down the amount of oxygen the blood can carry. Chemicals in cigarette smoke also make the blood thicker, more likely to clot. When a person cuts himself or herself, clotting is a good thing. But a blood clot inside the body, however, can be very dangerous. If a blood clot catches where plaques have already partially blocked the blood vessel, it can further reduce blood flow or cut it off altogether. Blood may not reach the legs, causing weakness and pain. If blood doesn't reach the kidneys, the result may be a buildup of poisons in the body. A clot can even cut off the blood supply to the heart muscles, which causes a heart attack. In recent years, medical researchers have investigated the connection between inflammation and atherosclerosis. You've probably seen your skin become hot and swollen, inflamed as a result of infection or an allergy. Inflammation can affect many tissues, including the walls of blood vessels. It can also cause chemicals connected with clotting to appear in the blood. Scientists are trying to determine whether some of the chemicals from tobacco smoke irritate the lining of arteries, creating a recurring inflammation that weakens the artery wall. Thicker blood and higher blood pressure can then cause damage in the weakened artery wall, creating a site where a plaque may develop. And whatever the exact cause, smoking speeds up the progress of atherosclerosis. Its contribution to the disease can be fatal, especially if blockages form in the arteries feeding the heart. Damage to heart muscles can disrupt the function of the organ. The CDC estimates that almost 82,000 people die from smoking-related heart attacks every single year. Like one story here, there was a teenage girl who told the story. It was actually about her best friend's mother. Her best friend's mother was a very heavy smoker. And she was just out shopping, a lady who was about in her 50s. And she was just out shopping, and then she just collapsed. And they rushed her to the hospital, but she still passed away. And so that's something that happens to a lot of people. And now looking at stroke. Strokes. A lot of people may not be aware that a tobacco smoke is closely related to strokes. If an artery supplying blood to the heart muscles becomes blocked, that obstruction can cause a fatal heart attack. Smokers suffer from other blockages as well, according to Action on Smoking and Health, ASH, which is often called ASH, an anti-smoking organization. Smokers are 16 times more likely than non-smokers to experience obstructed blood vessels in the legs and feet. Overall, smokers are 1.5 times as likely to suffer a stroke. A stroke, or cerebral thrombosis, as it is professionally called, occurs when a blocked artery cuts off the flow of blood to the brain. The results may be blindness in one eye or blurriness in both. Victims of a stroke may have difficulty speaking or finding the right words. Numbness, weakness, or paralysis may strike one side of the body. This condition could last for a few seconds, or it could go on for hours. If the attack lasts less than an hour, there might not be any brain damage. The episode is called a transient ischemic attack and is considered a warning of a stroke. Heavy smokers, i.e. people who smoke 20 or more cigarettes a day, are 2 to 4 times more likely to suffer a stroke in their lifetimes. A stroke is sometimes called a brain attack. It's very common. That's actually what I've commonly heard a stroke be, a brain attack. As with a heart attack, quick medical attention can make a difference in survival. When blood is caught off to the brain, none of the cells receive nourishment or oxygen, which kills brain cells. Depending on which part of the brain is damaged, results can include blurry vision, memory loss, speech problems, a sudden drop in the muscles on one side of the face, weakness or inability to move one's arms, legs, or both, and paralysis of half the body. If a stroke is diagnosed and treated quickly, the patient stands an improved chance of recovery. And drugs are used to dissolve the blood clot in the brain and may also be used to thin the blood so that it will flow more easily through constricted arteries. Efforts will also be made to reduce high blood pressure, which often accompanies a stroke. There will also be rehabilitation, which is speech therapy and or physical therapy. Approximately 1/3 of stroke victims make a full or nearly full recovery. Another 1/3 may be disabled to some extent, sometimes requiring help in like a rehab or a nursing facility. For those whose symptoms continue for 6 months to a year, the problem is likely to be permanent. They end up unable to move, eat, or speak normally. About 20% of stroke victims die in the hospital within a month of the attack. And among those deaths related to smoking are about 17,000. More than 17,000 stroke deaths are attributed to smoking. And so here, looking at the most common causes of death in the United States, just to give some stats out there. There are, and these are in the millions here. It's rates per 100,000 people. 267.8 are diseases of the heart. 202.7 are cancer deaths, all cancers. 61.8 are strokes. Chronic obstructive pulmonary disease, i.e. COPD, is 45.7. Unintentional injuries are 35.9. Diabetes mellitus is 25.2. Influenza pneumonia, 23.6. Alzheimer's disease, 16.5. Nephritis and nephrosis, 13.1. And then all other causes are 189.6. But look there, though. Those top four, are all related to smoking. Not all of these, top 4 deaths are smoking, but a lot of them are. Like we said, heart disease. A lot of those are related to smoking and tobacco. Like all cancers, that was second. Like the biggest one of those is, lung cancer. Well, that's actually the second biggest, but the most widespread in the U.S. And then, like I said, stroke. A lot of those are smoking, and then of course COPD. A big percentage of that. Like pulmonary disease is also attributed to smoking. And then going to look at a fun fact or fiction here. This is primarily for young people, but something good for people of all ages. So is this fact or fiction? You've got to be really old before you need to worry about the effects of smoking. Kind of depends on what your definition of old is. I'd say kind of more so in the middle. More so middle age would be better. Not necessarily young, but more so middle age. Because see, while heart disease usually strikes older people, smoking accelerates the onset of disease. See, instead of being struck in their 70s, like most people, like many people I should say, people who are non-smokers, most people who are non-smokers end up getting heart disease in their 70s. But smokers, though, get heart attacks in their 60s and even 50s, and like I said, even 40s. My brother-in-law passed away in his 40s because of smoking. And it does sometimes, happen even younger. It does sometimes, happen even younger, than that. Like, for people, especially people who start smoking young, like a lot of, 12-year-olds, who begin smoking, and then, by the time they're 14 or 15, they're, chain smokers. A lot of those people have issues, in their 30s. But if some of these ages might seem, comfortably away, for teenagers, consider the short-term effects of smoking. Bad breath, stained teeth, shortness of breath, impairing, many performance in many things, physical activity. And consider, too, that smokers are constantly coughing, irritating their lungs, and irritating the lungs of the people around them with cigarette smoke. And then you add up all the cost of buying a pack of cigarettes each day for a year, it just isn't worth it. And so thank you for being here with us today, and we'll actually be looking at tobacco. We're going to be looking at tobacco as a gateway drug, as a gateway drug in the next lecture, like with smoking marijuana, heroin, and cocaine, etc. So come on back and be with us next time, and we'll see you then. And until that direction, the shadows flee away. I am Dr. Coop, and I love you, and I appreciate you.